and it's lovely to be here tonight. I'd like to refer to Amy's book, and around your appointments and all the information that I'm covering here will also be in Amy's book, and that's in chapter 4 under appointments. And it's got everything in there that you would need to know. It also includes scripts as well. So things that you can use to help you explain what you need in an appointment as well. And lots of tips and information for pregnant women, but also for professionals as well. So that's chapter 4 in Amy's book. And as Amy said, I'm a consultant midwife and I work with Evolved Psychology, and I do autism and ADHD assessments, and I'm also clinical lead at the Marge. So let's have a look a little about environment and sensory issues. When you go into that first appointment, what are you going to expect? So the reception area is the first area you'll go. The option there is to self-identify as autistic and ask for maybe a quiet place to wait. So that would be talking to the receptionist initially. I would suggest wearing something like a sunflower lanyard for that interaction if you want to, but you can have it under a coat so you kind of show it to the receptionist and say, I'm autistic. Do you have a quiet place to wait? They might be answer that no, they don't. Then you can ask maybe, can you go and wait outside? Can they phone you when your appointment is due? Or could you wait in the car? And that might be you need someone there with you to advocate for all of that as well. Um, and then you can also ask to speak to a member of staff who's trained in supporting autistic service users. Now, again, people might have had training for that or they might have not, but it's something you can use to advocate for your needs. And also, there is the option to take noise cancelling earphones, I should say, and sensory aids. So things that help ground and calm you, such as smells or touch or sensory things. So if you've got a little fidget, or if you've got like a sensory stone or crystal, or maybe a smell that really calms you, like lavender, you can put that on your sleeve or even on a tissue. So if it's on your sleeve, you can just smell it and nobody's going to know. And it's just something that you know will help calm you and keep you grounded. So that first midwife appointment, usually around 8 weeks, and you're going to meet the midwife, maybe a student midwife in the room, and maybe a support worker who supports the midwife. Now, you should be asked for consent for a student to be in the room, and you can always say no. The only thing I will add is that sometimes it's quite helpful because a midwife who's training with a student midwife will often give a lot more explanation in the room because they're helping the midwife to learn. And also, often it means you might have two people who can support you through that moment as well. And student midwives can be really extra kind because they're not worried about filling in paperwork and things. So completely you can say no, but some people find that really helpful. Maternity support worker might be the person popping in and out and getting things to help the midwife. And then in that appointment, you're going to have physical checks, which will be a blood pressure check and a urine sample check and a blood test. So the blood pressure cuff should be on your arm. That will be tight, and you can be vocal about that. You can say, oh, it's too tight, or have you got a bigger cuff, or is there some other way you can do that? You can ask that information. Sometimes it's with an electronic blood pressure machine, and sometimes it's with a manual cuff. So there are some options that might be available with that. And a urine sample, when you get to the hospital, there's usually a toilet with lots of urine pots. You might have to do a urine sample in a little pot and you take that to the midwife or leave it in the toilet, or you might be able to have a little pot that has a top on it and you bring that into the room. If this kind of thing is really sensory averse for you, then you can talk it through with the midwife. Is there a different way that I can do that for you? You know, like I don't want to touch it. I don't want to do that in a public space. Can I bring one from home? You can bring one from home in the morning. That is okay. So don't think that you have to comply with everything. You can ask, is there a way this can be adapted for me? Blood tests, you'll have some blood tests that first appointment. Midwives are really aware that some people are needle phobic and extremely so. And also we know that people, when you're autistic, that can be really hard. You can have that conversation with the midwife. Again, the blood tests are completely at your consent. So you can have a pregnancy with no blood tests, but they will spend time explaining the reasons why you have the blood tests and maybe the possible consequences with that. But also there are things that have been done, like giving you some cream on your arm, which will be a local anaesthetic cream that can numb the area. You can buy that yourself, and also some hospitals do provide that. But at that first midwife appointment, without any warning, they probably won't have it unless it's in the main hospital. They might have it, but once you put that on, it takes 30 minutes to work. So there are options. Then they will ask you about your mental health, ask quite a lot of questions and fill in quite a lot of forms with you. Some areas are now asking, do you class that you have any neurodivergency? So it's up to you if you disclose or don't disclose. But it might be that one opportunity you've been waiting for to say, yes, I'm autistic and I need these kind of adjustments. I don't like lots of people in the room. I need you to talk to me really slowly, or just give me lots of information or no information at all, however works for you. And part of that, having that opportunity, is a personalised care plan, which most hospitals will have now. You can maybe sometimes you fill that online and take that with you. And that, again, is a little tool for you to use with the midwife. And you can ask for those reasonable adjustments. And Karen's going to go into those in more detail in a moment for us. You can discuss those best strategies that work for you, about eye contact, written instructions, or extra processing time, and you could ask for extra time and appointments. So could you have a 20-minute or 30-minute appointment instead of a 15-minute appointment, so it's not as rushed for you. So there's lots of opportunities there to ask. And if you haven't had a meeting with a midwife and you don't feel that's someone that you can develop that relationship with, and then you're told that's going to be your midwife all the way through, ask if there are alternatives. It might be you can go to a different clinic, or you can see a different midwife. So don't be scared about asking those questions. And then also, after that first appointment, you'll have ultrasound scans. And that first one will be 10 to 14 weeks. And that's to see baby's due date. And also there may be another blood test there as well. And also the 20-week scan is what we call an anomaly scan, where it will check on baby's growth and health and development, and if there are any issues with major organs. You'll have the sonographer with you in that room, and also you'll have the sonographer assistant, and you can ask about sensory needs around cold gel and things like that, and see if there's any adjustments that can be made. And again, if you have preference for the sex of that ultrasonographer, because that's quite an intimate situation, usually it will be just over the stomach ultrasonography, rather than internal. Sometimes it can be internal, but it's not always that first appointment. So if you have preference for having a female ultrasonographer, please do ask for that if that is available for you. And then other clinic appointments, you might see the midwife, might see midwife and doctor. So that will depend on the kind of care planning you need. You just need to be aware that those appointments can run very long. It's the kind of a clinic where situations arise that have to be dealt with, and the whole clinic pattern gets changed. Lots of change in that. So if you can go to those appointments, although your appointment might be at 10:30, you might not get seen till 12:30. So it's that kind of awareness that it's that kind of a long wait on those really busy clinic days. And also have some comforts with you to help with that, and an opportunity. It's your opportunity there to talk to the doctor and the midwife and about what you need from the appointment. It's not just about what they need to see that your pregnancy is progressing as it should. It's an opportunity for you to discuss your needs as well. And I would say a sunflower lanyard is a really good way to alert the health professional that you need some extra care, extra support, extra help. Some health professionals may ask, can I ask, what disabilities you have? But it's just a really good visual for them to see, okay, I need to be doing extra here to be able to support. And then who are you going to meet on that journey? As we said, receptionist, maternity support worker, midwife, student midwife, your consultant obstetrician, your registrar obstetrician, and an SHO is a senior health officer, and your ultrasonographers. Now you can see there you've got three different doctors. So your consultant obstetrician is kind of like the top of the hierarchy, if you like. So you'll be told you're under such doctor such and such. So they'll be the person that might be the specialist for diabetes or the specialist for thyroid issues. And then under them, they'll have a team which includes registrars and then some SHOs. Now, if you have a meeting with the consultant, and again, if it doesn't go as you would like, or you prefer a particular sex, or if you would prefer somebody else to talk over your issues with, you can always ask for a change of consultant. And it's just an awareness that if you're under a certain consultant, you'll go to that consultant's clinic, but then you might see the registrar, which is the next doctor down, who will be representing that consultant. And if there are any things they need to clarify, they will go to the consultant for consultation. So just to give you an idea, you might go to the appointment, there might be just one doctor, there might be two, or there might be three. But again, they're all there on a learning opportunity. So if you would like to just speak to one particular person, you can. And again, if you would like to speak to a more senior clinician, then you can ask for that as well. And so everything is there in Aimee's book under chapter 4 for attending appointments for you. And I say there's lots of information there on scripts that you can use and everything that would make that journey a lot easier for you. Thank you.